Hi everybody, it's Elizabeth here again. And so I've already talked to you about how diabetes and exercise in my first presentation. Now I'm going to talk to you about cancer and exercise. So this is just a little bit of what we'll be going over, for just what is cancer, how exercise can impact cancer and vice versa, a little summary, and then of course you can see all my references. So to begin, what is cancer? It's a general term for a group of about 200 diseases. By definition, cancer is uncontrolled cell growth, and it's not just any cell, they're abnormal cells that were damaged from a variety of causes. It could be environmental, lifestyle, genetics, or unknown. The specific names come from the type of original cell. So a carcinoma is epithelial cells, so that could be anything from the lining of your intestines, skin, anything. If it comes from the blood, it's termed leukemia. The immune system is lymphoma, and connective tissue is sarcoma. It's most common in adults at least 55 years old because it takes several years for cancer to develop, and because of that, they may also have other chronic diseases, and they've been exposed to what the carcinogenic longer. And carcinogenic is something that is believed to increase the likelihood of cancer. Males and females are about as likely to develop cancer in their lifetime. It's about 1 in 2 for males and about 1 in 3 for females. So just a little bit more review. And the initial symptoms, they can either be localized to where it's coming from, or it could be systemic. An example would be someone with lung cancer could just have a cough. Relapse occurs when one or more cancer cells survives treatment and then it proliferates and returns. You're considered to have been cured of cancer when remission is believed to be permanent, and most doctors say about 5 years with no relapse. And almost anyone going through cancer treatment or a cancer survivor can benefit from rehab and exercise. And there's a variety of stages of cancer. The treatment is going to be dependent on not just the location, but also the stage. And the stage will also impact the likelihood of survival. So stage 0, carcinoma in situ, that's the very beginning of cancer development. Stage 1 is a localized tumor, and stage 2 is a localized tumor, but it has started to spread to nearby tissue. Stage 3 is spread to further tissue, and stage 4, metastasis, it's completely spread. It's everywhere in the body, pretty much. And these are just some different risk factors. There's 2 different types of risk factors: non-modifiable, so things you can't change, and modifiable, things you can change. You can't change your age or your gender or family history. There are certain environmental conditions that you can't change. And if you have certain medical conditions such as ulcerative colitis, it could increase your risk of developing different forms of cancer. And modifiable, smoking, excessive alcohol use, obesity, unsafe sex, frequent sunburn, and so that's why it's advised to always wear sunscreen. And different things in the environment are modifiable, such as if you live with someone who smokes, while you may not be smoking, you are inhaling secondhand smoke. And different diagnostic tests are used to determine whether or not not only do you have cancer, but also what type. Doctors can do a urine analysis. They do a blood analysis. They're really looking at a CBC, or complete blood count, so that look at how many red blood cells you have, your white blood cells, and how much of each different type, electrophoresis, tumor markers. A biopsy is where they go in and take a sample of the suspected tissue and test it. Usually that's going to be done in surgery. X-ray and other imaging. Other imaging could include ultrasound, MRIs, CTs, or anything else. Miscellaneous could be doing an endoscopy for possibility of esophageal cancer or even stomach cancer, or colonoscopy if they suspect colon cancer. And some common treatment methods, it depends on a number of things. The type, the stage, whether or not it's metastasized to other areas, your personal beliefs, your overall health, and just what your team decides would be the best course for you. Usually it's a combination of things, such as surgery and then radiation. Now, one thing that's interesting about surgery, right now doctors have to go in and remove more than what they think they need. But they may not get it all, so they'd have to go back in. And this has led to researchers in the United Kingdom developing a specialized knife, scalpel, that is being termed the sniffing scalpel because as the surgeon cuts, it's also cauterizing the tissue or burning it, and it's analyzing the smoke to tell surgeons whether or not they have gotten it all, and it tells them while they're still in the OR. And these are some different side effects of treatment. So as you can see, the pain or different forms of pain is the most common side effect. There's also loss of flexibility, nerve damage, and these also depend on what type of cancer you had. So next we're going to get into exercise in cancer. So we'll cover exercise testing and prescription and how the two can impact each other. So survivors often experience disease or treatment-related physical limitations. This means they could be less flexible, or they could fatigue more easily. They could have bone damage. And some of these symptoms may occur early and then resolve on their own, or be permanent. And as long as you modify the exercise testing prescription for the individual, it should still be safe and beneficial. The objectives include maintaining strength and endurance. Basically, you want to improve how their body responds to treatment. And exercise can actually help reduce some of these side effects of treatment, such as nausea and vomiting and fatigue. So when you're actually exercise testing, it's very similar to what you would do for a healthy adult. Some things you can do would be to test their aerobic capacity. You can use a cyclogometer, and with that you would also on a constant measure the 12-lead ECG and heart rate. You would stop when they've reached their VO2 peak or they're experiencing serious arrhythmias. You could also use a treadmill and you would monitor blood pressure, which would also give you the rate pressure and their rate of perceived exertion on a scale of 6 to 20, 6 being too easy and 20 being I am about to die. I need to stop. And you would stop at their systolic blood pressure, so the top number, which is when the heart is contracting, is at least 250 millimeters of mercury, or the diastolic, which is when the heart is in between contractions, is greater than 115. You could do a 6 or 12-minute walk to test their endurance, and that you're just looking to see how far they can get, or they get to the point where they're too tired to continue. For strength, you're most likely going to be using free weights or weight machine, and you're going to be looking for either a 1 rep max or a 3 rep max. Again, going until you either hit that point or until they're just too exhausted to continue. For flexibility, goniometry or sit and reach, you're looking for either distance or going for an exact measure of their flexion, extension, and other movements depending on the joint. Then for functional neuromuscular, you're really looking to see how much assistance they will need, either in testing or in their day-to-day life. You're looking to see really how well they can take care of themselves and whether or not you need to modify exercise in order to make it safe for them. Now we're going into exercise prescription. So based on the FIT principle, frequency is going to be very similar for healthy adults for aerobic exercise, about 3 to 5 days a week, resistance 2 to 3 days, flexibility can be done daily, intensity, you'll start with how well they're responding and their perceived exertion, and then you'll go into the same intensity as the healthy population. For time, aerobic activity is going to be about 75 minutes a week of vigorous exercise or 150 minutes of moderate. And just like with healthy adults, you don't have to do this all at one time. You can do this in multiple bouts in the same day, just as they tolerate it. And for the resistance exercises, you'll want to do at least one set of 8 to 12 reps. And everything is going to be looking at large muscle groups. And for flexibility, you're also going to want to focus a lot on areas of restriction, and meaning where they've lost range of motion, either from treatment or as a side effect. And as you progress, they may need to progress slower than their healthy counterparts. And you also have to monitor their symptoms. If exercise is causing an increase in fatigue or other adverse effects, you need to back off. There's some special considerations that you need to always keep in mind about cancer patients and cancer survivors. It's about 90% will experience cancer-related fatigue. So they may have times where they don't feel like doing something or they're just too tired, but they need to avoid inactivity. So you may have to modify it, especially based on their level of fatigue. If it's their exercise that day is walking laps around their house, that's what they need to do. You also need to modify exercises if there is metastasis to the bone, because as the bones will be more fragile and prone to fracture. You also may have to develop exercises that they can do at home or in a medical facility such as a hospital when they're in an immunosuppressed state, so if they're actively going through chemotherapy. And those with anything that enters directly into the body, such as a catheter, central line, feeding tubes, or anything else, they need to avoid swimming because of the increased exposure to bacteria and other germs. Then, if someone is actively undergoing chemotherapy, they may have periods where they don't feel well and they're more tired than usual, so you'll have to adjust what they're doing. And just like you would with the healthy population, you need to monitor symptoms to see if you need to stop and send them to the doctor. And always allow adequate time to heal after surgery before exercising that body part. Just a little summary of what we've talked about. Cancer is a group of about 200 diseases. Treatment has to be individualized. Almost all can benefit from regular exercise. You have to consider what they're going through, just like you would for a healthy adult. And then these are some of my different references. And these are the rest of them. Thank you for taking the time to watch. Let me know what you think, and hopefully none of us ever have to go through this ourselves or with someone we love. Thank you.